Jesse, you have 2 minutes to make a affirmative statement.
Of course there should be. Why wouldn't we have nationally mandated nurse-to-patient ratios? We are here because we are patient advocates. Nurses. So if you look at the numbers, realistically, all of the patients need to be cared for. We need to find a way that we can not overload nurses, because once a nurse has been working for 8 hours, they start to lose their focus. I mean, let's face it. If you're working 12 hours, which many states have 12 hours, luckily in Oregon we are able to have a very strong ONA, and we can have 8-hour shifts. But not every state is like that. So I think we need to make sure that those nurses who might be overworked, who might be tired, let's make sure that they at least don't have too many patients. Because we need to have some kind of a mechanism that will control the amount of nurses, or control the amount of patients that a nurse can have, rather, and at the same time be able to have some teeth to it, to make sure that the hospitals follow what we put together. We don't just want to put a law together that says, this is what we think. We want to put a law together that says, this is the maximum amount of nurses, this is the maximum amount of patients that a nurse can have. And make sure that it's adequately staffed. Because otherwise, we're going to have people who are tired, who are making bad decisions, and our patients' care suffers. So we definitely need to have nurse-to-patient ratios that have teeth and make sure that hospitals listen. Thank you.
Bianca, you have 2 minutes to make a negative statement.
Of course, we've all studied the same evidence-based practice, so I'm going to copy off of Jesse and Rebecca, and we know that we cannot have nurse-patient, federally mandated nurse-patient ratios. It has to be driven by an algorithm, as Rebecca said, that will make sure that you look at the patient acuity, and you have to look at the skill of and the experience of the staff, and that means the nursing staff and the unlicensed professional staff. So there's absolutely no way that we can have federally mandated nurse-patient ratios, because that puts our patients at risk, because you don't know what type of patient you may have when you walk onto the floor, and you don't necessarily know what type of skilled nurse you may have if you get a float nurse.
Jesse, you have 2 minutes to respond and close.
Okay, so what I have to say to that is there are many hospitals whose main goal is to cut costs. I'm sure all of you have seen it. One of the hospitals that I've worked at, I will not name a name, they at one point decided they were going to not give graham crackers. I mean, they cut everything out down to saltines. I mean, we are in a time when hospitals are cutting costs everywhere that they can. We need to make sure that these hospitals don't start cutting costs where it matters most, which is patient care. So we need to make sure that these patients have adequate care. We need to make sure that nurses have the resources that they need. If we don't have a nationally mandated ratio, then the people of one state might be able to dictate that their nurses have 6 patients or 7 patients, while another state who has a stronger nursing presence in their management has a more adequate staffing level. So what we have to do is make sure that there is a maximum ratio of patients to nurses, because otherwise we have no way to ensure that our patients across the nation are taken care of. So that is why we have to have a ratio. Thank you.
Bianca, you have 2 minutes for a response and closing.
The ratio can't be driven by something that's federally mandated. We can't have ICU patients have just ICU patients, maybe 2 ICU patients to 1 nurse, because that patient may have something that's going on that's much more serious, and we have to make sure that the nurses have the skills and the experience that they need in order to deal with those patients, and so that we can have the best patient care that's available.